and painful joints, a fever, and a rash on her face after she goes out in the sun. So she figured she should probably go to her doctor, who told her that she might be experiencing symptoms of systemic lupus erythematosus, and suggested that she go to an info night on SLE to learn a little bit more of what it's about.
Welcome to our information night, Nora. So systemic lupus erythematosus, also known as SLE, is an incurable autoimmune disease that affects multiple body systems. Prevalence is higher in women aged 15 to 40 and less common in men than women by a 10-to-1 ratio. In a healthy person, B cells, which play a role in our immunity, produce antibodies which detect foreign bacteria and viruses by sending out signals for other cells to destroy them. This is a normal immune response. However, in lupus, B cells produce abnormal antibodies called autoantibodies. They specifically produce many anti-nuclear and anti-phospholipid antibodies. These antibodies play a role in the destruction of the nucleus and phospholipid bilayer of the cell. These antibodies detect cells that belong to our body as foreign antigens. This causes them to be destroyed by other cells of our immune system, such as T cells and macrophages.
This results in chronic inflammation of different tissues and organs in the body. It is suspected that there is an alteration of the 6th chromosome linked to the onset of this disease. Chromosome 6 codes for MHC proteins, which play a role in identifying and communicating between self cells versus non-self cells. This could be one of the reasons for the B cells producing autoantibodies against their own cells. Homeostasis is interrupted because the body is producing a vast amount of autoantibodies that continuously flag self cells as foreign antigens, causing the body to destroy cells, leading to inflammation and tissue damage.
Lupus is often referred to as the disease of many faces because signs and symptoms can present themselves in a variety of ways. This includes a rash, like Nora felt with her symptoms, that is usually in the shape of a butterfly across the cheekbones, called a malar rash. This malar rash tends to be photosensitive and results from an abnormal inflammatory response to prolonged sun exposure. You can also experience with lupus a serious complication called CNS vasculitis. It occurs when inflammation of the blood cells of the brain and can cause really serious complications like seizures, psychosis, and a very high fever.
You may also experience blood disorders such as vasculitis, and that is when lupus affects the simple squamous epithelial cells of the veins and arteries, and the inflammatory response greatly impacts blood flow. One may also experience serocytitis, which includes pericarditis and pleuritis. Pericarditis affects the heart and pleuritis affects the lungs. It is the inflammation of the pleura of the heart and lungs and may result in excess fluid buildup around these organs. This is called effusion.
Lupus can cause inflammation of the glomeruli, which are the tiny filters in the kidneys. This is called glomerulonephritis. This causes damage to your kidneys as it makes it harder to filter out waste. This can lead to kidney failure. Inflammation of the GI tract is also experienced from people with lupus. This can cause digestive problems such as weight loss and weight gain and vomiting. Arthritis is a very common symptom of lupus as the immune system will often attack the fluid lubricating the joints, causing them to become very painful. In conclusion, although research is still being done regarding SLE, current scientific research believes that SLE is an autoimmune disease that is chronic, incurable, and affects many organs of the body. There is a homeostatic imbalance where both B cells and T cells become overactive, and as a result, there is an increased number of autoantibodies produced that attack the body's own cells, and as a result, ultimately, inflammation throughout the body occurs.
So Nora, just to review, as you can see on the diagram, the orange antibodies are the body's own antibodies, and the pink antibodies are our autoantibodies that attack the yellow cells. The B cells are the blue pom-poms, and the T cells in the diagram are the green pom-poms. Thank you for attending our information night, Nora.